Right, so let's get started. Hello, everyone. It's great to have you all with us this evening. And as you know, our theme this month is nutrition and diet. And our host today is for our second live session is Mary Pegington from Manchester. So, for those who doesn't know Mary, she is a microbiologist who trained to become a dietitian in Leeds, and since I think 2006, she has worked at University of Manchester on many different research studies, looking at the links between diet, lifestyle, and cancer risk, especially breast cancer risk. So we're so lucky to have her here today and hear about her studies because she's so passionate about encouraging healthy lifestyles to reduce the chance of developing disease. So keep your ears open, everyone. So before we start learning about this topic, I would like to introduce our structure to those who are new to our platform. So in the next 25 to 30 minutes, Mary will be answering our questions, and after will be sort of giving us a talk, and then after this we will have a 10-minute comfort break and resume back for a Q&A session. So during the break or during the discussion, please feel free to post your questions through the YouTube channel or through other social media channels that you're watching this live stream from. And during the break, I will collate all of these questions and will be asking these on your behalf. So again, if there are any follow-up questions, please feel free to submit these. So Mary, would you like to, well, first of all, thank you very much for joining us. And it's an absolute pleasure to have you here. And as a former breast cancer research fellow, I really look forward to learning more about your research. And please feel free to start whenever you're ready.
Thank you so much. Thank you for inviting me. I'm just going to share my screen now. Let's get this started. So let's see if you can hopefully see that my first slide. So thank you so much for inviting me. It's really exciting to be here. My name's Mary Pegington. I'm a research dietitian. I'm based at the Nightingale Centre, which is at Wythenshawe Hospital. And I also work for the University of Manchester, and I'm going to be talking tonight about healthy living in young women to prevent breast cancer. So what I'm going to go through is, this is my little plan. We're going to look at some breast cancer rates, look at some figures. We're going to look at a lot of different risk factors for breast cancer. I'll talk briefly about what research we do here in Manchester and why I think we should be focusing on young women who are at increased risk of breast cancer and our current plans for action. So first of all then, breast cancer rates. So some of you might already be aware that breast cancer rates in the UK are going up. So this graph here shows along the bottom, we've got 1993 down here going all the way up to 2015. That's 22 years, and you can see the pink line is going upwards like that, isn't it? So the rates of breast cancer are on the increase. And we know that we have in the UK over 55,000 new cases of breast cancer each year. So that's 150 women each day who get that news of a diagnosis on average. This disease affects 1 in 7 women in the UK. And we have to bear in mind the cost of this as well, of course. So each case of breast cancer costs upward of £13,000 to the NHS, and that's just the monetary cost. There's all the other psychological costs and emotional costs and everything else that goes along with a diagnosis of breast cancer. And we know that the picture here is that line that going up, that rates are increasing in the UK, but this is also happening in many other countries around the world. So what do we know about risk factors? Well, we know a lot about the risk factors for breast cancer, and I'm going to put them into 2 boxes here. We're going to look at what we call the non-modifiable risk factors. So things that generally you can't really do much about, you can't really change that much. And the modifiable risk factors, which are more in my interest, in my work interest really, those are the things that I tend to work on most. And let's start with the non-modifiable ones. So The first one is being female, of course. So women are at much higher risk of developing breast cancer than men. But we mustn't forget about the roughly around about 350 men who are diagnosed with breast cancer each year in the UK. The next few things are things that really do affect a woman's hormone levels, and that really does play a big part, have a big influence on her risk of breast cancer. So first of all, age of starting periods. So as soon as a girl starts her periods, her body is exposed to high circulating levels of hormones, and that's one of the things that really does drive up breast cancer risk. And since the mid 1800s, the average age of a girl starting her period has dropped from age 17 down to age 12. So that's a really big difference. And we know that for each year earlier that a girl starts her periods, that leads to a 5% increase in her breast cancer risk. So that's our first reason why that pink line on the slide before was going up. Next one is age at menopause. So you can imagine you've got when you start your period, your body starts being exposed to all those high levels of hormones, and that stops at the menopause. And we know that the age of menopause has changed as well. So in 1908, the average age of menopause was 49, and now it's budged up slightly to 51. So that's another reason why we've got a longer period of time being exposed to those high levels of circulating hormones, increased risk, and rates are going up. Each year extra that a woman has those circulating hormones for, each year later that the menopause is, that leads to another 2.9% increase in risk. So next we've got age at first birth. So having children earlier in life is protective against breast cancer. Having a child under 35 years leads to a decrease in risk. Having children after that age, just like I did, increases the breast cancer risk. And this has also changed over the past decades, because women tend to be working, juggling careers as well, and so they delay having children. So that's another thing that's and all these things add up to these increased rates of breast cancer. Number of pregnancies as well. The more pregnancies a woman has, the lower her breast cancer risk. And breast density, or mammographic density, is something you might have come across. So breast density is another risk factor, increases your risk of breast cancer, having more dense breasts. And what do I mean by this? Well, I'll show you some pictures of this. So this is breast density, or mammographic density. We can see this on a mammogram quite clearly. So within the breast, you've got the lobes, the milk ducts, and then you've got the fatty tissue. So this is a mammogram from someone with a low breast density. So there's not a lot of glandular tissue in the breast there. Whereas this one here with high breast density, so an increased risk of breast cancer, you can see there's a lot more white in this mammogram. That's a lot more glandular tissue. So a woman with this type of breast with a high breast density would have a higher risk of developing breast cancer. So next we've got family history and genetics. So bear with me on this slide, I'll explain it. So we're going to concentrate on these yellow boxes here. And along here, we've got population frequency. So this is how common these things are if you gather together a group of women. So down this end, we've got not very common at all. And up here, we've got very common. And on this bar here, we've got what is their impact on breast cancer risk. If it's just a little bit above this line, they have a small increase in risk. If it's higher up, then we've got a much bigger increase in risk. So here you might recognise some of the names in here. These are what we used to know as gene mutations, or now we tend to call them pathogenic variants. So you might have heard of BRCA1 and BRCA2. So these are mutations within those genes. Very rare. But if they do happen, if someone does carry one of these mutations, they have a much higher risk of breast cancer. It really does make a big difference, but they're very rare in the population. And we think only about 2.5% of breast cancers are caused by those genes. We've got also still quite rare other genes, mutations in other genes that cause a slightly lower increase in risk. And then down here, we've got SNPs. So SNPs are single nucleotide polymorphisms. And what we mean by that is you've got your DNA here. And up here, you've got a G and a C joined together as base pairs. And it's just changed on that one base pair to a T and an A, and that's a single nucleotide polymorphism. And these can, and the scientists have found out that these happen in areas of interest within the genome. They've found hundreds of places where these can happen within the genome. And if a woman just has one or two of these little changes, it might not have a big impact on risk. But if she has many of these little changes, then that can add up to quite a large effect on her risk. So these can kind of be combined, and we can work out a score, a polygenic risk score it's called, for a woman based on all these kind of hundreds of little changes that can take place within the genome. And these are quite common, as you can see, a lot more common within the population. So let's move on to the modifiable ones. So this is the area that I tend to work mostly in. And first of all, we've got weight and weight gain. So we know that adult weight gain increases risk of breast cancer. And let me talk you through all this. There's lots of pink on this slide. So we've got a risk ratio of 1 here. So these are the people that we're comparing this to. This is no change in risk, we'll say here. For these people who have stayed within 2 kilograms of their weight. So they've either lost a bit of weight or gained a bit of weight, but more or less between the age of 18 and the rest of their adult years, they've stayed within 2 kilograms, which is about 4 pounds. So stayed quite steady. And you can see if you gain within 2 and 10 kilograms during those adult years, your risk goes up by, this means 20% increase in risk here. If it goes up by between 10 and 20 kilograms, then you've got a 60% increase in risk, and you've got a doubling in risk if someone has gained over 20 kilograms, which is about 3 stone, just over 3 stone, which is by no means uncommon in today's UK society. A lot of women do put a lot of weight gain on from the age of 18 through their adult years. So we do see many women who do gain this amount of weight, and their risk of breast cancer is doubled. We know that the majority of weight gain happens earlier on in adulthood, before the age of 35. So on this slide here, we've got different age groups here, and we've got what proportion of those women within the different age groups are an ideal BMI or a healthy BMI. So between 18.5 and 25 kilograms per metre square, we call it for BMI. So the 16 to 24-year-olds, about over 50% of them are that healthy BMI. But you can see there's a dramatic drop here between age 16 and 24 and the 25 to 34-year-olds here. Okay. So you try and get rid of that in case you can see it. So we think it's really important to stop this weight gain from happening, to try and keep these percentages high as we go along through the adult years, and not let this weight gain from let this weight gain happen, because many of you might know from experience of friends and family members that once you've gained weight, it's really hard to lose it. So we think preventing that weight gain from happening in the first place is a much better idea. So if I can move my slide, and there we go, alcohol next. So sorry about this, guys. You might not want to hear this, but we know that alcohol does really increase breast cancer risk. And once again, on this slide, we've got 1 as no increase in risk here. And this is 0 grams of alcohol per day, which is 0 units, okay? And you can see anything above an average of 0 units a day starts to increase your risk, really. So any amount of alcohol on average does lead to an increase in breast cancer risk. Until we can see a doubling of risk around this area here, which is around about 8 units on average a day. Okay, so this would be a bottle of wine is about 9 or 10 units. So this is slightly less than a bottle of wine a day. So a fair amount of alcohol to have over what we would recommend for women. But you can see it really does have that level of alcohol would really have a big impact on the chances of a woman developing breast cancer. And we know that alcohol particularly increases risk when it's consumed during this sensitive time between when a girl starts her periods at whatever it is, age 12, and the first pregnancy as well, whenever that is. And during that time, we know that all sorts of things happen. People go to college and university and get the first paycheck. You know, there's quite a lot of drinking, that alcohol that goes on during this time, and it really does affect later breast cancer risk. We also know that alcohol particularly increases risk for women who already have a high risk due to their family history of breast cancer. So breastfeeding, this I put in green here because this is really good for reducing breast cancer risk. So it has a small but significant effect on reducing breast cancer risk. And in the UK, we're pretty rubbish. Our breastfeeding rates are pretty low. So it'd be really good to see more effort put into supporting women starting breastfeeding in the first place and carrying it on to 3 and later on to 6 months as well. Contraceptive pill and HRT, both of these act to increase a woman's breast cancer risk. I won't dwell on those too much. Exercise, another one in green. This is again really good for reducing breast cancer risk, but unfortunately the levels of exercise in women tend to be pretty low, and there's a real slump after about age 15 in women. So women here on this slide are the not filled in blobs. So you can see from the age of 15 the proportion of women who participate in team sports goes way down like that, which is really sad. The boys are in the black here, they're way up here, and still they do get a decline, but the girls never quite reach the levels that the boys do. And these are our individual, this is how we participate in individual sports as well. And once again, we just see that steady decline, and wouldn't it be great if we could get those levels higher in the first place and keep them high as well. We know that physical activity, exercise, call it what you like, can reduce breast cancer risk by about 20% for women, including those women with a family history of breast cancer. And physical activity during adolescence, during adulthood, it's all important for reducing breast cancer risk. So next we've got smoking. Smoking is another thing that increases breast cancer risk, and unfortunately we see the highest proportion of people smoking are in these younger age groups as well. So it may increase breast cancer risk by up to 20%. It's not as important in terms of breast cancer risk as alcohol or weight gain, for example, but it still does play a risk, especially for women with a family history who are already at increased risk of breast cancer. So it will increase risk in those women more than women who are at population risk. So those are all the risk factors that I'm going to go over. And Cancer Research UK have estimated that 23% of breast cancer cases in the UK are preventable if we could only get people to adhere to these healthy lifestyle behaviours. That's nearly 13,000 women a year that we could prevent from getting that awful news. And other scientists have come up with different estimations, maybe around about a third of breast cancers we think could be prevented. So what do we do in Manchester? Well, this is what we do in Manchester, of course. No, we don't really. I work with Dr. Michelle Harvey, who is our lead research dietitian at the Nightingale Centre, and together with Professor Tony Howell, they wrote this book, the 2-Day Diet book. And we've used the 2-Day Diet on loads of different research studies in the prevention of breast cancer setting, and in women after a diagnosis of early breast cancer, and also after a diagnosis of metastatic breast cancer as well. And we've had really good results from this. It's a really good evidence-based diet. Now, since book got published, Tony Michel's book got published, and there's been loads of other 5-2 diet books out there. Of course, you'll have seen them all on the bookshelves. We would say the Michel and Tony's one is the original and the best still. So we do a lot of work with different population groups, trying to work out best ways, easiest ways for women to stick to diet and lose any excess weight. Now I'm going to put forward my case for why I think we should focus on young women who are at high risk of breast cancer. So hopefully from the talk so far, you'll have picked up that there's quite a few things that happen in young women and in women who have a family history of breast cancer. So we know that weight gain, most of the weight gain that a woman is going to gain in her life happens before the age of 35. We know that both alcohol and smoking in young adulthood has more of an effect on later breast cancer than doing those behaviours in later adulthood. And they both have more of an effect in women with a family history of breast cancer as well. And at the Nightingale Centre, where I'm based, we've got our Family History Risk and Prevention Clinic. And many women who are concerned about their family history or have increased risk of breast cancer for other reasons attend our clinic, and there are around about 100 other family history clinics around the UK. And we would like to work with these women to find some sort of solution to engage them in healthy living to try and reduce their future breast cancer risk. So our plans for action is that we've been working with young women from our Family History Risk and Prevention Clinic to develop an intervention. They wanted a remote intervention even before the time of COVID. They wanted a remote intervention because they didn't want to have to be going into clinic all the time. So we came up with an idea to produce an app, and that went down really well with them, to make an app that would engage them with healthy lifestyles. And this is our plan. This is what we'll be doing. So this is our development of an app for young women in breast cancer at Family History Risk and Prevention Clinic. So we'll develop this app. We then plan to run it in through a very small feasibility study, and this will show whether women will actually use the app or not. And then we'll do a bigger multi-centre RCT or randomised controlled trial, and we'll involve other family history clinics in this as well. And this will see whether the app actually does what it says on the tin. Does it actually stop weight gain? Does it engage women with healthy behaviours? Does it cut alcohol use, smoking and things like that? And if it does, then hopefully we'll get it rolled out in the NHS so that it's available to all of these women, these young women who are at high risk, who currently don't get a lot of support or no support at all for all these lifestyle changes that could really make a big difference. So at the moment, we're on the app development stage down here at the start. Oh. And it's got stuck slightly in university systems at the moment, but we're hoping the university will give the green light sometime soon and let it carry on. So fingers crossed on that one. And just to say a few words about Prevent Breast Cancer, who are a really special charity because they are the only UK charity who are focused solely on prevention of breast cancer, and they fund loads of really good research in Manchester and elsewhere. So check out the website if you do have a chance. There's loads of information on there, including a lot of information about the risk factors that I've talked about, which is a good source of information there. And lastly, just to say thank you to, well, particularly all the women who have been involved in the trials since I've worked with Michelle Harvey for the last 15 years or so. To my supervisors, Michelle and David French, who's a health psychologist as well. The other professors that work in the Family History Clinic at Wythenshawe, Tony Howell and Gareth Evans. The other people who are developing the lifestyle app with me, who aren't mentioned already above, are Alan Davies and Julia Muala, and I'm funded at the moment by the NIHR Manchester Biomedical Research Centre. And thank you so much for inviting me to talk as well.
Lovely, thanks very much for your talk. It was very interesting to listen to. And what we're going to do now, we're going to take a 10-minute break. So we will be back at 7:05, and at that time we will be going through audience questions. Thanks very much. Right. Hello, everyone. Thanks for being there during the break and for submitting your questions. So, what I would like to do is, again, Mary, thanks very much for your talk. It was really nice to hear about. I'm going to start with one of the questions that has been submitted to YouTube. So the audience is asking, is there research to suggest that certain foods are good at preventing breast cancer, or is it more about weight management and exercising?
Thank you for the question. That's a really good question. And that's something we get asked a lot because I think everyone wants to know if there's just one food or a couple of foods they can just throw into the diet and make sure they have plenty of, and that will keep them safe. But unfortunately, you know what I'm going to say, no is the answer to that one. We know that keeping healthy, exercising, keeping your weight at a steady weight, not drinking too much alcohol, those things have so much more impact than any particular food. There's some evidence that foods that are high in fibre are beneficial, but we'd recommend high fibre foods in a normal diet anyway. And there's some evidence that saturated fat isn't great news for breast cancer risk. And of course, that's another thing. We wouldn't recommend too much saturated fat. So that would be like having butter and full cream milk, full fat milk and cream and things like that too often. So we wouldn't recommend too many of those types of foods either. So there's no particular foods that would keep you safe from breast cancer, unfortunately. Have the bigger picture is more important here.
Okay, all right. So there is a sort of question that can follow up on from that. So you mentioned that you found out in your studies that weight loss reduces risk of cancer. So how does losing weight prevent cancer? Can you tell us a bit about that?
Yeah, that's a good question. Well, how does being overweight increase the risk of
Yeah.
cancer, I guess? And there's lots of different mechanisms. So I'll just mention kind of a few things. We know that when people are carrying more weight, especially more weight around the middle, then they have higher levels of insulin in the body. So insulin is the hormone that the body releases, the pancreas releases to bring your blood sugar levels down. It's the hormone that's related to type 2 diabetes as well. And we know that insulin is a growth promoter for cancer. So if you're overweight, your body is more likely to be producing more insulin than it maybe needs to, higher levels of insulin in the body, and that's going to increase a risk of cancer. So that's one of the mechanisms. Another one is that being overweight and carrying too much weight can cause inflammation in the body as well, and this is really complicated, but at low levels of kind of chronic inflammation in the body are not good for all sorts of disease types, and cancer is one of them as well. So there's loads of different mechanisms that scientists have come up with to explain why there's quite a few cancers, so around 12 cancers that are increased in people who are overweight or obese. So it's not just breast cancer. And the good news is with breast cancer is that if you lose weight, if you can lose 5% of your weight and keep it off, then you do really make a significant difference to your breast cancer risk, and you can really bring your risk down. And so if you manage to follow a healthy living diet, a healthy eating diet, lose the weight gradually and keep it off is the really important thing, then you will be really making a big impact on your risk of breast cancer. And not only that, other diseases as well that are linked to weight. So all the cardiovascular diseases, for example, type 2 diabetes, they are all affected by weight.
Okay, thank you. This was a very detailed and clear answer. Thanks very much for that. So can you tell us a bit more about, so you mentioned about the studies which found that, how much your risk is reduced when you lose weight and how much weight you lose. Can you tell us how you actually designed those studies and how you actually, analyzed the weight loss and everything, all the data that you actually acquire in a study like that, so we have a better understanding of how these studies comes about?
Yeah, those are good questions. That's a good question as well. So in all of our studies that we've done, I talk about weight a lot, but we're not only interested in weight, because we know that weight doesn't give us a full picture. We think the harmful thing about carrying excess weight is not carrying excess muscle, but carrying excess fat. So it's all about how much fat that's in the body. So we would not only measure weight routinely in women on our studies, we look at body fat as well, body fat measures, and waist circumference, hip circumference, and lots of other readings as well. So it's not only about weight. So when we're studying the two-day diet, for example, we would compare that. We would do a randomized controlled trial. So women will be randomly allocated to either following the two-day diet, or we tend to use a Mediterranean style diet as our comparator diet. And once you've got women randomly allocated to a diet and following it for exactly the same amount of time with exactly the same support to follow both of those diets, and then at the end you can really tease out the differences in how that diet has affected them. So differences in weight loss, differences in the waist circumference, differences between when a woman starts and ends the diet, differences in insulin levels, all of these things we'll look at, and it will give us the picture of whether the diet has been more beneficial in terms of helping the woman lose weight and body fat than compared to the Mediterranean diet. We compare to the Mediterranean diet because we know that that's a really good diet. We know that that prevents cancer. So if we can come up with something like we think we have with the two-day diet that does the same job, maybe even better, and is perhaps easier to follow for people trying to follow it, then we know that it's a good diet to recommend to people, which is what our studies have shown.
Right, great, thank you. So this is the next question from the audience. Why and how exactly does giving birth after 35 years increase risk of breast cancer?
I think I'm going to pass on that question because that's not my area of expertise, and I would hate to lead anyone down the wrong path, but it's a very interesting question, and I'm sure someone's probably told me the answer to that before, but I'm not going to make a guess on that one.
Okay, all right, that's absolutely fine. So you talked about healthy diet, and you mentioned that you sort of compare it to Mediterranean diet. So can you tell us about the 5-2 diet in a bit more details? What does it entail? What does 5-2 diet mean? And do you recommend that, or with the app that you're developing, are you hoping to get young women with increased risk of breast cancer because of their genetic background to actually apply this 5-2 diet?
Yeah, so with the 5-2 diet, this came across. Michelle Harvey originally started doing the studies using this because there were suggestions from other research that being in that state of having reduced calories for a certain amount of time was beneficial to the body. But researchers all around the world are still researching, the whether it should be 2 days or 1 day or more days, or you do kind of a week of reduced calories every so often, or loads of different variety in how we could possibly do this. Intermittent energy restriction is what we call it. So we do the 5-2 diet because we think 2 days is a long enough time to have the body in that state of reduced calories, and it's doable as well. Whereas a lot of the diets out there aren't really sustainable long term. But the women on our diet often keep on doing the diet after the study ends as well, if they've really got on with it. So how the diet works is on 2 days together, we would recommend. Women are following quite a low carbohydrate diet. So no bread, pasta, potatoes, breakfast cereals, things like that on those 2 days, and having more of a higher protein diet with all your fruit and vegetables as well. But it's mainly protein. You've got your dairy foods in there or your alternatives for your calcium intake. So you're still getting everything you need for those 2 days, but low carbohydrate. And on the other 5 days, then it's more of a Mediterranean balanced healthy eating diet. So reintroducing there your ideally whole grain carbohydrates, so your wholemeal breads, your brown pasta, your oats and things like that to those 5 days. And we found on our studies that that this diet can lead to really good weight loss and loss of waist circumference inches as well, and women tend to find it a bit easier to follow than a Mediterranean diet. I think what we need, what we always think, is that we need lots of different diets, because nothing fits everyone, does it? So if you want to lose weight, you should have some options of what you think will work for you. And a lot of people do find that they can stick to a 5-2 diet easier than they can a kind of everyday diet. So we've proven with the research that it's as good as following a Mediterranean diet, maybe even better, but it's another option for people to have in their toolkits of what they can follow. So hopefully that'll give you some idea of what we mean by the 5-2 diet. In terms of what we'll be using in the app, to start with, that app will be designed for younger women who haven't yet gained weight. So it's more about weight gain prevention than weight loss. So it's trying to get those behaviours happening to stop that weight gain from happening in the first place, really. Obviously, if women need to lose weight, then the 5-2 diet is a really good option for them. But if we can stop the weight gain from happening in the first place, that's our aim, really, because even with a good diet like the 5-2 diet, it's still hard to lose weight and keep it off.
Nice, lovely, thank you. I'm just going to check if we've got any other questions submitted to YouTube. I think that was it. I think we haven't got any new questions submitted. Well, thanks very much for your time this evening. It was an absolute pleasure to have you with us, and we look forward to finding more about your studies in future.
Oh, thank you so much for inviting me. It's been really interesting. Thank you.
Thanks.